So with that, we will get started with questions.
Governor, travel to other states near our neighbors. Governor Lamont said he wants to have an agreement like New York, New Jersey, and Connecticut have with Rhode Island and Massachusetts. Is that it? Are the talks underway with that?
Yes. I think I'm very interested in that. Obviously, as we've talked about here, I've been trying to have something like that with Governor Baker in Massachusetts, because I think that we share so much commerce together. But in fact, just earlier today, I connected with Governor Lamont. He's in favor of it, very much so. I've reached out to Governor Baker, so it's something that I would favor, and I hope that we can do it. I just need a little more time to work on it.
Has Baker been calling back, or?
Yeah. I just reached out late last night. I'll get with him today, and we'll talk it through.
Doctor, do we have a sense of, or even a hard number of the amount of asymptomatic people who are testing positive? And then secondly, can you paint a picture, either rough or exact, of the severe cases that we're seeing, so hospitalizations and deaths, the demographics of those folks?
Thank you for that. So asymptomatic cases are more prominent in our younger population. More than 50% of our 20s, 30-year-olds are among people that are asymptomatic. That's why our message is most critical for that group, and why it's understood that those age groups feel that everything is fine and are going about their business. So that's the key place for us to sound the alarm about what's going on. And in terms of the numbers that we are seeing, I want to make sure I captured your second question effectively. It's, are we seeing anything different in our outcomes with hospitalizations and otherwise?
Well, I guess in layman's terms, are we seeing more elderly folks with severe pre-existing conditions in hospitalizations and deaths, or are we seeing someone who's perfectly healthy 32-year-old turn up with a severe case?
No, unfortunately, coronavirus is consistent in how it impacts people that end up being hospitalized or end up dying. There's still the focus on folks who have underlying illnesses or are frail and elderly that are at higher risk of hospitalizations and death. It's possibly why we're not seeing as many of the increases in hospitalizations, but it's also why we really want the message to the younger, healthier feeling individuals who are out there, although you may feel like you're fine and you're not at risk to go to some form of social gathering and not wear a mask. What ultimately happens is somehow there is exposure to someone who is at risk, and then that person is in the hospital or has some other negative, preventable outcome. And so everyone really getting involved in wearing their mask regardless of how they feel, particularly those populations that are more likely to not have symptoms, is a critical message.
Can I follow up on that?
Yes.
People who test positive who are asymptomatic, how often do they then develop symptoms? How severe is their illness? Is there any difference between the asymptomatic people and people who test positive symptomatically?
The key difference is the symptoms. There's a portion of people who are asymptomatic early on in their illness and then can go on to develop symptoms. But there are many people who just have no symptoms throughout the entire course of their illness. And again, that's particularly in the younger, healthier population. Dr. Birx referred to it as invisible spread. And it's our focus with this messaging: wear your mask, stay local, avoid gatherings socially, avoid non-essential activities, get tested, because these are ways to combat the invisible spread that is happening, particularly among the younger, healthier population.
Roughly what percentage of those people who asymptomatically test positive never develop symptoms?
Let me get back to you on what that actual number is.
Got a recommendation for people to take it easy. Go ahead. Governor, on your recommendation to play it safe for 14 days before Thanksgiving, there may be some people, my guess is maybe some teachers who've been critical of going back to school that may throw going into school as maybe not a great place for kids and teachers to be in the 2 weeks leading up to Thanksgiving if they want to get together with family. What do you say to people about that environment and others that they should avoid? Or I'm going to guess you're going to say not to avoid that, but leading up to Thanksgiving.
We haven't seen any evidence of widespread spread in schools. You know, just look at the data. Schools are pretty safe. In fact, as I've said so many times before, and it still continues to be the case, the prevalence of the disease is higher in the kids who are learning virtually from home than the kids who are in school. I think the reason for that is they're structured environments. Like, if you're sitting in your seat with a mask on, several feet apart, that's a structured environment. So we haven't seen any, there's no data in Rhode Island, or actually anywhere in the world, to suggest that schools are a vector of spread. The problem are the social gatherings. When we get close, we hug people, we take our masks off, we share drinks, we share food. That's what's the problem.
Have you seen any spread from kids to their family members, kids who have gone to school? And just, I've also heard some people say that the contact tracing system in schools is a little bit of a lag, and how soon are they getting the information if somebody, a close contact, is tested positive?
I'm actually going to let the doctor answer that because she's on top of both of those.
Yes, so children are less likely to spread within the school settings where there is structure. Whether a child or an adult, when you're in a setting where there isn't structure and no mask wearing, there is a higher likelihood of spread to occur. So it can happen where children and adults end up being positive. Oftentimes, we see adults who have been out socializing becoming positive, and then the child becoming positive. It's sometimes not easy to tell, but it's knowing that they're in a household together, socializing as they normally would, without wearing a mask, and that really highlights the importance of just the mask wearing itself. From the contact tracing piece, I really want to acknowledge my heroes in all of the folks that are working on case investigation, contact tracing, our testing, our laboratory. Those are the systems that people are doing 12, 14-hour days to keep running strong. What we want to make sure is that people also have the information. If you have symptoms, you should not be sending your if your child has symptoms, you should not be sending them to a game to participate in, whether or not masks are worn, and expose to other individuals. We want to tell people now, the less you interact socially, the less likely it is for you to transmit the virus. So when workers are going out to dinner together and exposing each other and then going to work, that's going to contribute more to transmission. And we've had that happen among workers within the K through 12 system. So what's key is people understanding if symptoms are present, be able to stay home. If you have someone in your household that has symptoms, particularly the new cough, difficulty breathing, loss of smell or taste, have everyone stay home until testing can occur. These are things that as our team reaches out to inform individuals, they already have in mind the things that need to be done and are not out and about with those symptoms still causing spread to other individuals. I hope that answers it, Brian. I can certainly share more.
Follow up to Brian's question. We've heard that there may be incidents involving soccer teams, and that some referees are now quarantining and so on and so forth. Are those the games that you're referring to? There
are a number of examples. And so some of them, yes. I mean, it's just the key of knowing if symptoms are present, you need to not be outside.
Doctor,
and get tested immediately.
Doctor, as of this morning, COVID exit strategy, which is run by a consortium of universities and public health agencies, reported that Rhode Island is at 86% of capacity for hospital beds and 89% of capacity for ICU beds. So first, is that accurate?
No.
And is there any, what are the numbers correctly? And is there any possibility of utilizing a field hospital?
No, so I appreciate you raising that. We have had multiple conversations with the national entity that feeds information into COVID exit strategy about correcting data points. So this is one that we'll be reaching out to them to correct. Our hospitals are ready. They have the capacity that's needed. There isn't any intention of moving to a field hospital because of the capacity that is available in hospitals currently. Also giving what I had shared about more younger individuals being infected, asymptomatic or symptomatic, so they're not the same numbers in the hospitals the way we saw early on in the year. So we'll reach out to that national entity and make sure the numbers get corrected.
What are the occupancy rates right now?
I will get back to you on those numbers as well.
Far below 50%.
For sure.
Governor, you're not just, I have a question for the governor, Doctor. You're not just the governor, you're also a resident of Providence. Last night was the most violent night since the night of the riot, 21 arrested. Have you spoken to Mayor Lorza or any plans to maybe implement some sort of a curfew?
So I've been speaking with him. I haven't spoken with him today. First of all, I'd like to say thank you to the Providence Police, who I thought did a fantastic job last night under enormously difficult circumstances. I also want to say protests are good. We need them. Violence is never acceptable. And it was striking to me that the young man who tragically is now in the hospital, and I hope he's well, his parents were saying, please leave. We had a peaceful protest. It's time to stop. And then the violence began. So arrests were made, as you say, and I think the police handled themselves well under really difficult circumstances to try to keep the peace. Whether or not the mayor imposes a curfew is his call. What I have said to him is the state police stands at the ready to assist as we have throughout all this violence. Sadly, we're gearing up for a rough month or so at Halloween and after the election. So it's the mayor's call if he wants a curfew. I'll support him, and the state police is working really well with the Providence police to keep the peace.
This business of the bikes on the road. Now again, is this something your neighbors deal with? Mr. Smiley has experience with the mayor. Something needs to be done, but it doesn't seem that the Lorza administration has a solution as to what to do about these bikes.
Something does need to be done. Many of these bikes are illegal for use on the streets. You will see them on the streets driving the wrong way and to oncoming traffic, doing wheelies, etc. And I know the mayor is working hard on it, and I agree with you that action is required.
Now, back in June, you saved a lot of trouble when you called out the National Guard. Any thoughts? I mean, Halloween is Saturday night. The protesters are not going away. Any thought about the National Guard?
If it's necessary, we'll go there. We're not there yet. But we're talking about everything. Let me say this to the people of Rhode Island. We are planning for every eventuality, and I am not worried. I am confident that between the state police, the local police, the National Guard, if we have to go there, Rhode Islanders should feel confident that just as we handled it in the summer, we'll handle it safely and keep the peace for whatever comes our way.
But you're not afraid, last week they were on the highway, 21 arrested. There's a feeling, Governor, that Providence is out of control.
Again, you ought to direct all this to the mayor. I don't want to get in the way of whatever plans he has in place. My position is there's no place for violence. Those who are planning it should rethink their plans, and if they do it anyway, certainly the state police will be there, and if necessary, the National Guard, to provide support, because the people of Rhode Island deserve to know they're going to be safe. Anita's been waiting.
Naturally, I want to talk turkey here. So the logistics of things.
Say again, please.
I said naturally, I'm going to talk about turkey here.
Okay.
Logistically, it seems as though it's going to be a nightmare as far as serving food. You said not to share food. You carve a turkey, you share. Can you speak to people who are planning their dinner and how they have to logistically handle this, and to the people who say, I'm going to do whatever I want to do regardless of what you say. You can't control the people I have in my house.
Yeah. So a few things. There are people who say that. I hear it every day, Nita. And it's true. I cannot control what happens in your house. And by the way, I'm not going to try. Like, I am not going to have some kind of enforcement going around to your home on Thanksgiving. But I will say this. If you have that attitude, and if you say, I'm not wearing my mask, I'm going to have a big party, you just need to know you're contributing to other people losing their lives and other people losing their jobs. If a lot of people do that on Thanksgiving, I know what's going to happen. More people will be in the hospital, more people will die, and more people will lose their jobs because we're going to have to throttle back on the economy. So, of course, you're free to do it, but it's selfish and it's wrong, and I don't think that's the Rhode Island spirit. I don't think that's the spirit that has gotten us this far. The spirit that has gotten us this far is the spirit that says, I love this state, I love my neighbors and friends and family, I love the fact that Rhode Island, I want you to be a part of helping Rhode Island. I don't want you to be a part of hurting Rhode Island. And so that's, what I would ask people to think about. Like, right now, we still have an opportunity to influence the end result here. We don't have runaway cases. To answer your question, we'll get the exact data. We are far below 50% capacity. I am not worried at all at the moment about opening a field hospital. So let's not get there. So don't say that at Thanksgiving. Do the right thing so we don't get there. Do you have specific guidelines for food preparation and such? Yeah, I'm going to let her handle that.
The critical piece in the holidays, the biggest takeaways we want people to understand is the mask wearing and the value of avoiding social gatherings leading up to a particular time when you're going to interface with a loved one, particularly someone that has risk of illness or is frail and elderly. Things like not sharing food is more so referring to, using the same utensils, you eat from it, and then someone else that you don't live with eats from it. It definitely is expected and understood that for Thanksgiving you have one big turkey and you cut pieces and give that out. Those types of things are fine. Hopefully there's not more than 5 or so people. Ideally, you're giving it out to people that you live with, and that's it. Everyone else can watch on Zoom. But the key is the mask wearing, keeping your numbers small, staying local, and avoiding those gatherings that we know are putting people at risk.
Governor, I'd be remiss if I didn't ask, as we've looked at the moped Providence police incident videos from every different angle, it does appear that none of the Providence police officers are wearing masks. Is this something that has been brought to your, I know it's been brought to your attention because we've brought it to your attention, but in recent times has been brought to your attention? And why is it that we seem to find police officers often not wearing masks while on duty?
Yeah. It's frustrating and disappointing, and when I see the videos, I have the same reaction, which is, come on, guys, we've been at this for 7 months. You know you're supposed to wear your mask. Could you please wear your masks? Having said that, in the heat of the moment, you can imagine you're getting things done, you're hustling quickly, and somebody might forget to put their mask on. So I'm not excusing it. I understand it, and I'm asking everybody, nobody's above the law on this one, including police, myself, let's go. Strap the mask on and don't forget it. It's not excusable, although, of course, I can understand it. If you are responding to the scene of a crime and your adrenaline's pumping and you're getting in there, you can imagine why it might happen.
One of the reactions I've already seen, to your announcement on the jobs program and how you're using $45 million of the CARE money for that, but still criticism that enough money has not yet gone out to small businesses. Why not redistribute some of that, I guess?
Well, we've put out over $150 million, the vast majority to small businesses. I also have to help the people of Rhode Island who are out of work. If you're listening to me and you worked at I don't know, a retail store or the mall or a big box retailer for 20 years or a hotel, you're out of work and you're scared because those businesses might not come back for a long time. So I have to do both. We have to do both. We have to help small businesses, but we also have to give a hand to the individuals who need a job. I will say, if you look around, we're way ahead of Connecticut, for example, on getting money out the door quickly to small businesses, ahead of Massachusetts. We may do more. I'm not saying we shouldn't do more, but we're going about as fast as we can go in order to get money out to small businesses.